conference will now be recorded.
All right. 9 o'clock, so we're just gonna get started. I know some people are coming up online. Good morning, Gail. Good morning, Rebecca. And everybody else. I don't think we have a quorum today, so we do have some notes from the last meetings, couple meetings that will go on to next meeting. So we'll just start the meeting. Introductions. I'm just going to go around again today. We haven't done this for a while. Just introduce yourself and who you are. If you're a sector representative or a boat member, just say so. So I'm Chris Hogue. I'm the director of Drug Free Communities and co-chair of BOAT.
Gail Loser, Sergeant with Belchertown Police Department. Am I a sector rep or just not a member of both?
Both.
Yeah. Both.
Yeah. Both.
Got to go park and rec, so I figured it out.
And sector rep.
Okay.
Liz Monopoly from the West Springfield Care Coalition.
Hi.
Melissa Graham from Probation and Belchertown.
Jay Kroll from the Police Department and I'm the school resource officer and actively voting member of them.
Aline Mata, Community Engagement Coordinator for Drug Free Communities and Secretary of BOAT.
Gail?
Morning, everybody. I'm Gail Grammarosa, and probably the most relevant hat here is I'm chair of the Belchertown Opioid Settlement Funds Advisory Committee.
Rebecca or Kathy?
Rebecca Edwards, she, her pronouns. I run the Drug Free Communities grant for Ware, Warren, and West Brookfield.
Good morning, I'm Kathy Coutinho. I'm the DART coordinator for the Department of Health and Human Services in Northampton, and we help do the DART program in Belchertown.
Great, good morning, everybody. All right, so we're just going to talk about some discussion meetings, just go through things that that we've done and that are coming up. Just to give you some numbers, we love statistics. We still have Smart Recovery going every Wednesday from 7 to 8 at the rec center. I am going to be checking with Joel Lee to see if those hours are going to change or any of the dates or how it's going. We're going to check in with her, but it's still going on. It's been pretty successful for like 6 months now. On 8/20, August 20th, we did do a mindfulness meditation program. We brought somebody in from the Falmouth to run that at the Recovery Center of Hope, and we ended up having 15 attendees. It was really, really awesome and well attended. We have a couple more people that just popped in, so I'm just going to have you introduce yourselves. I think Lauren, Kim, and Lisa just popped in, so if you want to jump on and introduce yourselves, that would be great. And just where you're from.
Hey folks, Lauren Kelly, she, her, Hampshire Hope coordinator based out of Northampton's Department of Health and Human Services.
Morning, Lauren. Kim or Lisa, are you guys
Hi,
on?
sorry, I'm trying to get my camera on. Doesn't seem to be working. Hi everybody, Lisa Goldsmith, I use she, her pronouns. I'm with the Collaborative for Educational Services and the Spiffy Coalition.
Hi.
Hi, Kim Dewey from Belchertown, pediatrician and the health board, health sector rep.
All right, great. And then Deb Keith just walked in, so we'll have Deb introduce yourself and what your sector rep status is.
What my sector rep said.
You're the school sector rep.
Oh, yes, that's right. I'm the school nurse leader in the Belchertown Public School District. Sorry I'm late, but
yeah.
duty calls.
No, welcome. All right, so back to this. So that mindfulness meditation program was really successful. We are thinking of doing it with probation coming up after work, but I have to get a hold of Christy. I haven't done that yet, so today I am going to do that. So we're trying to put something together for them again. As we connected with probation last year, we did a couple programs with them. We think it's really important to have that connection. And so, we'd love to give back. And we'll be in touch about that. All right. Next thing is the National Fentanyl Prevention Pop-Up. We did, Aline and I did a pop-up uptown. We had one person come. One is better than none. So we do have our next Save a Life Day is coming up next Thursday. So we will be, Aline and I, or myself, will be up town again on the common, giving out fentanyl test strips, some naloxone, and also medication lock boxes. We have a ton of medication lock boxes, so we'll be doing that. So we're doing these little pop-ups now around giving out Narcan. I know Boat used to do it over 4 years ago, once a month. They'd go uptown, and it was kind of like interesting because when they would do it, it was like we'd stand up there, we'd had everything in a paper bag, and people would do a drive-by, and you'd kind of sneak it to them. And a lot of the stigma around that's been smashed, so people are just coming and asking for things today. So that's a really good progress that we've been making in Belchertown. Let's see, Recovery Center of Hope Fair is tonight from 2 to 6. We will be tabling there, so that will be a fun little event to go to. So we'll be there today. Another event to table at. Our farmers markets have wrapped up. We had a really great summer. The total youth reached this summer, not counting this past Sunday. I did get your numbers, Deb. The total youth reached this summer was 101. Adults reached was 106. This is people are coming by our tables now and getting resources. So this is great. 106. We gave out 28 boxes of naloxone over the summer. So very successful summer event. Tabling we've found has been so important for us in connecting with our community. That's how we do it. Awesome. Thank you for tabling this past weekend too, Deb. Guess what's this weekend? Huh?
Fair.
You skipped the vigil.
There.
Belchertown Fair. What'd you say?
You skipped the vigil.
I know.
Okay.
Yeah, so the fair is this weekend, which means boat marches. And so we are looking for marchers. I'm going to be reaching out again today to everybody on boat to see if anybody wants to march with us. We do have props this year. We have 2 brain costumes from last year that we're going to use again, that we're hoping to have a couple students come, which only we'll talk about. And we have signs that says, water your brain, feed your soul. Addiction is a brain disease, stuff like that. So we also have, because it's a cow thing, shake, rattle, and shake cattle and roll. We're going to be wearing cow things, ears and noses, and we have some costume stuff. And then we have the little bullseyes. Candies that we're throwing out this year. We were going to do cow tails, but it was too expensive. So we got the bullseyes, which we have them. We have a ton. So we definitely need some help. If anybody wants to come, we are meeting in front of the library by 8:45. You have to be off the roads before 9 o'clock. They're shutting down the roads. So if anybody wants to come, let me know after the meeting. That would be super. All right. So just back up, the vigil that we had this year was probably one of the most touching vigils that we've had. We had 35 adults attend with 11 youth. It was from 6 to 8 on the 28th. We had a memory wall this year, which the first time that we've done that, and we had several people contributing pictures. We had people speaking. We had an Empower Health group come this year as our guest. Every year we invite somebody new too. And so that leads me to Empower Health group is having a recovery in the park next Sunday, the 28th. The 28th in Forest Park in Springfield. And it's a huge event. So anybody, that is interested in connecting with other organizations, this is a great time to do that. So we'll be out there. I'll be there tabling. If anybody wants to table with me, I am looking for somebody else to do that because Alina's going to be out of town. But I can do it myself as well. So that's going to be good. And then the day before the 28th, on the 27th, we have Sober in the Park in 3 Rivers. So we have a lot of tabling events coming up, which is great. And Sober in the Park, I went the first year, and it is just like the last few years, it's just gotten bigger and bigger too. So that's great that we have such great, support in our community in Western Mass. On October 4th, we have Lake Wallace Fall Festival from 8 to 5. So we'll be there at that as well. SOAR 5K is the next weekend. We're tabling for the next 5 weekends basically. And the SOAR 5K is from 10 a.m. to 2 p.m. And the location's different this year. And it's down off State Street, correct?
I believe, yeah.
Yeah, in that.
Kind of tucked behind the senior center, right? That's right.
Yeah, okay, over that way. Yep, over by the senior center. Yep. So it's going to be a little bit different this year, and I know they are holding a scarecrow contest, right? So people that are interested in doing that can go to the webpage, Honest Beginnings or SOAR webpage, and look that up. Oh boy, Red Ribbon Week is around the corner. And that is one of our signature weeks for BOAT. Already lined up. We are having our drive-in movie on 10/25, which is also Drug Take Back Day and Out of the Darkness Walk. So Helping Hand students every year do Out of the Darkness Walk. I cover Drug Take Back Day with the Belchertown Police Department and the Sheriff's Department. And we're going to be doing Vape Take Back Day again this year. So I'm going to try to advertise more around the Vape Take Back Day. We didn't get hardly any last year, but that's something that is a new initiative of ours. The other thing with Red Ribbon, we are going to be putting ribbons out on the 24th around town. And at the schools, I do have to get permission to put Red Ribbon Week signs and our banner on the common, which we'll be sending out shortly to get that permission. The Friday night before that Friday night of the 24th, we are kicking off Red Ribbon Week, and we are going to Pathfinder Belchertown football game. And at Pathfinder High School. BOAT is going to be tabling there. We need as much, help as we can get. Some of our Helping Hands kids will be there handing out red ribbons to people, little lapel ribbons. And also, we do have a popcorn machine, and we're going to be giving out free popcorn to the people that go to the football game. And on the popcorn bag, we will be putting a social norm on there as well. So everything that we do is totally streamlined. Like, we really want to make sure everything's connected, so we don't do a one and done type of thing. So that would be Friday night, and then Saturday night is a drive-in movie, Drug Take Back Day, Out of Dark Walkness. The next week is Spirit Week at the high school, and I think the junior high school did it last year, but the high school will be doing it this year. District-wide Wear Red Day is Wednesday on October 29th as well. Then we have Trunk or Treat that night with the PTO. Usually we get like 500 kids there. It's crazy busy. So that night we have Trunk or Treat. And then we do have a speaker coming. We have Amy Neville will be coming into the district. We had her set to kick off Red Ribbon Week on Monday in the schools, but there's a conflict now because there is a special town meeting, so we can't do it. We are going to plan on when?
November 5th.
November 5th. So November 5th, we're hoping to have Amy come into the schools for grades 6 to 12. We've already been, in the works around this. We have booked her. And then that night, she will be showing a film called Out of the Darkness. And Alina's going to talk a little bit more about that.
Yeah, she's going to show a film during the day and then a different film in the evening for parents. And we're going to have some sort of a panel of professionals so they can answer questions after the event.
Can you talk about Out of the Darkness? What is it about?
Well, I'm not sure if it's Out of the Darkness or if it's Can't Look Away, but it's about social media, and safety with kids, how to stay safe, what are the potential dangers. Amy's son, Alex, on Snapchat, obtained a fake pill that was laced with fentanyl, and he unintentionally ended his life. So she started this so she could support everyone all over the country, and she'll travel anywhere.
That's right. It is Can't Look Away. That was my mistake.
Yeah, she has a few out.
Yeah,
so.
yeah, I knew it is Can't Look Away that she's going to be looking at, and I know we've sent it all out to everybody to preview beforehand. But it is going to be a big parent night that night, and I am going to be putting a panel together. So I will be asking somebody from the Belchertown Police Department to be on the panel at some point. But we will be putting that together, in the coming weeks. You too. Yeah. Anyway, so that's going to be pretty cool, and that's going to be the following week. So basically, like I said, everything that we're doing is connected to each other. And then at the movie night, what we do with the drive-in movie, we give out free popcorn that night. We're having also a costume contest because it's right around Halloween. So we're going to have a costume contest. We have 2 age groups, I think up to 12 and then 13 and older that we did last year. And so giving out the free popcorn, we do put a social norm on that bag as well. A different social norm. So they are getting information as we're doing all of this stuff in education. We were shooting to do a PSA with our Helping Hands kids, but it might be a little bit tight. So if we can pull it off, we are going to show that PSA before the movie, the drive-in movie. So that'll be pretty cool if we can do that. All right. Any questions so far? Any comments, questions? All right. So that's basically what's going on with us. We're pretty busy. So we're going to move on. Does anybody have updates on Opioid Settlement Fund Committee? Gail or Kim?
Sure. Hi, everybody. Couple of things maybe to note. The committee is going to be meeting on Monday, the 22nd. That's our regular monthly meeting. At that meeting, it took me a while to connect up with them, but we're going to have a guest speaker from Boston who is with what's known as the HALO program, HALO. It's an acronym that I can't remember, but that's the group that manages a fund that the city of Boston created for expenses for community members after an overdose death. So often those funds are accessed for funeral expenses, burial, other counseling, support after an overdose death. So we've been, as a committee, very interested in this idea of a local fund that people could apply to in order to, cover the cost of things that no other programs tend to cover. I think our committee wants to hear from Boston. We're looking at their application process and their decision-making process, and then think about how that might work in our community. One of the thoughts that our committee has had is that we might want to go broader, not just post-overdose death expenses, but also maybe think about ways to do it. So obviously there's a lot of logistics involved when you're talking about giving money directly to community members, and an application process and a vetting process and a documentation and tracking process. So very excited Monday to hear from a staff member of the program in Boston. Another thing to make note of, I guess it was last week, maybe the week before, I attended a statewide webinar by the State Attorney General, Andrea Campbell. And the good news is there are 2 more settlements coming down the pike. They and other attorneys general across the country finally have settled with Purdue Pharma and the Sackler family. And then there's another settlement, which is a combined group of smaller manufacturers of prescription opioids. I didn't recognize any of the names. There's like 8 of them, but they're relatively smaller compared to the bigger pharmaceutical companies. So they put them all together in one lawsuit, and that's being settled. So good news, more money coming. I know for sure, and I've been talking with our town accountant. I know for sure that Belchertown signed on to the Purdue Sackler family settlement, and we're in the process of signing on with the other one, which is called the secondary opioid manufacturer settlement. We still have some time for that. There's an October deadline to sign up for that second one. According to the AG, the money is likely to start to flow to municipalities from those two extra settlements. So we still have all the other money we're getting and will continue to get, plus more money from these two new settlements. They're looking at maybe by early 2026. They've got a lot of things to sort of finalize, figure out the formula, how much is each community going to get out of these settlements. So maybe late this year, early 2026. But glad to know that there will be more funding coming down the pike, and we will then have that as the overall pot of money that the town of Belchertown has. I think that's it. I had just a quick question for Boat and the schools. I know some other folks that are waiting to hear have not heard anything, but I wondered, no word from the drug-free communities program about either new grantees or like Boat and the schools want to do a renewal of their second 5 years. So we're still waiting on that. Just a reminder to the whole group, no worries. Should that funding not come through, and I'm pretty confident it will for Belchertown, but if it doesn't, the opioid money has already been approved to cover those expenses plus more to add on to hours for staffing. So should the federal money not come through, then Boat and the schools are not in jeopardy of not having a drug-free communities grant going forward. So I think those are all the updates from the opioid, the Settlement Funds Advisory Committee.
Thank you, Gail. And yeah, so for our grant, I've been checking on it like daily to see what's going on with it. And no 6 to 10 years have been released yet. We're hoping by the end of the week. This week, when I talked to my project officer, he said the second or third week of September. So it's going to happen soon. We just don't know when. And gratefully, we, Boat is employees and funding is covered, so that's a good thing. We thank you for that, and the opioid committee. All right, so we'll let you know, Gail, too, as soon as we find out, and I'll see you on Monday anyway at the meeting. All right. Let's see. So we have up next is any public health information at all? Andrea's not on today, so I don't have anything. I know that Kirsten Krieger resigned, which I think I mentioned last time, but some people weren't here. So our public health nurse did resign in Belchertown. So what happened, just to FYI, like in August, we wanted to kick off our wellness resource fair, right? At the library, partnering with the library. And the week before it happened, Kirsten left, and so it just became too much of a debacle for me to take over at the time. I had a report due. I just didn't have time to take it over within that short notice. So we did cancel it. We don't have one coming this Friday, which would be the time. It's the third Friday of the month that we established it, but because of the fair, we pushed it till October. So we are all talking now again with the library in Marson. We do have WIC coming in October. We may have the WOW bus in October, but I'm going to be reaching out to about 4 or 5 more organizations to come, which I already have some on board. So we are a go for the October resource fair on that third Friday of the month. So finally kicking that off. All right. Okay, so Helping Hands Drug-Free Communities, I just want to share this with you. Our open houses, high school, we don't ever get a lot of people at the high school, in and out. We had 10 adults, 5 youth stop at our table and get resources. Chestnut Hill Community School, we had 50 adults stop at our table, 75 youth. And then Jabesh Brook, I don't have the numbers for that.
We were busy.
It was similar to Chestnut, but maybe a little bit lower than Chestnut.
A little bit lower.
Yeah. So same thing. We did teach youth mental health first aid at Westfield White Oak School. I don't know, 3 weeks ago, and we trained 27 adults that day. Very well received. Our evaluations were excellent, and the group was very interactive. For 27 people, it was a very interactive group, so we were happy with that. HIDA conference, I know Helene went to that, the 15th and 16th, so do you want to share anything?
Yeah, it was, the title of it was Health Promoting Relationships Paradigm. And it was 2 days, and the main focus being on how to develop micro skills so you could continue to support youth and teach them coping skills. And also, one thing that really resonated with me was the success of the intervention with youth depends upon the interior condition of the intervener. So it's important that you are, healthy, well, in order to help somebody else. So.
Yeah, and in Belchertown, we do have our handle with care system too.
Yeah.
And it's been really successful from what I understand. I think last year there was like 84 interventions that were successful around, I think over 100 maybe. But yeah, so that was good. Thank you. Anything else from Helping Hands?
Let's see. Our first meeting is going to be this Monday. The 84 has reached out and asked if any of our Helping Hand students could present about their mural project. Gina is, what's the title? She's a youth ambassador for the 84, and she's going to be one of the people presenting about it. They're going to help out with putting the ribbons out, and that's all I have for
parade.
Oh yeah, we have 3 students helping with the parade. They're going to be marching and wearing the green costumes.
Social norms.
We're starting a social norm campaign.
So anyway, Aline just got back from a conference. So we are doing the Healthy Hands are going to be doing the social norms campaign this year. Our focus is going to be cannabis and vaping, especially the vaping. So we did get our 2025 PNAS statistics that every single area went down for 30-day use except vaping. And so, we want to know, what we can do within the schools to help this, what education is being done out there. If kids are getting caught vaping, what is the protocol? I don't know if the schools can speak about that at all, but, these are some of the issues, when we see that people aren't being educated when they're getting caught, that's the best time to intervene. With this. So we're hoping to do a little bit more around that this year, if possible, to help these students out. But everything else has gone down significantly. And I plan on presenting to the school committee, probably November, December is when I usually present to the school committee our statistics. Any other questions around that at all? Yeah.
Are you, and this might be too early to tell in the schools, seeing an uptick in the nicotine salt, like the Zin packs and stuff?
Not that I'm aware of.
Yeah.
Okay.
It's easy to.
Well, one of the things, we haven't, I haven't heard much about it, and Jade, I don't think has seen much of it either. We banned Zin from Belchertown. So, we banned it to adult stores only. It's getting national attention now also. So, that is one thing, is that we don't have it in our town, and we have nicotine-free generation. So we do have a lot of safety guards around our kids, our protective factors, which is huge. With the nicotine-free generation, with the banning all that other stuff. So It's been pretty good. And that's another thing that we're gonna be doing, probably, I would say November, is we need to do purchase survey checks for nicotine-free generation specifically. I do have somebody, that I'm going to be using, so, I'll tell you after who it is, who I'm gonna be using. And then, this person's friend is going to be doing the alcohol purchase survey after that. But we won't, that's gonna be November. We'll talk about this in October. We're also doing sticker shop this year with our Helping Hands kids in November. So there's a lot of things that we have on our table, coming up, but this is what we're doing now, so.
So that's something to know about over on nicotine and.
Yeah.
and that. I know in the past, that you and I had talked about getting temporary signs for the fair. Do we only have permanent ones up there for the fair?
Yeah, so I talked to Linda LeDuc about it and Andrea, and they haven't had signs, like, we've been trying to order signs.
I thought there was one on the gazebo.
I don't think they put one on the gazebo.
Yeah.
I think there's one.
We were gonna add more though.
Add more though. I think there is one out there.
I know there's one, but we were looking to do it like over by the PBTA bus area, because we see cigarettes all over the ground over there by the bus stop, so like putting that up there too. But yeah, at the fair, I mean, just gotta keep an eye on it. So I'll talk to Andrea again about that, because we have to get some more nicotine-free generation signs too, posted. I know that like Pride Station doesn't have it. In a couple places. I kind of did some environmental scans real quick recently. So, anyways, yeah, so I'll check in on that.
And the other thing, as far as like signing, I know that I'll probably bring, because of the schedule this year.
Yeah.
I'll probably bring drug take back for the 5K.
Okay.
Just with, so it's got the date.
Yeah.
I don't know where to put it though, if I should put it in front of yours, or if I should put it in front of like the PD setup. We'll talk about it later.
Yeah.
I'll bring it.
Okay, all right, we'll talk later. All right, and any DART updates?
We're moving forward. We have a roundtable discussion for increasing transportation coming up in October.
Awesome, that's great, that's great.
It sounds like there's a lot of good work being done on this by a lot of people, so it's been a long time coming.
Yeah, it has, yeah.
And then as far as the responses in town, I'm finding that we're dealing with long-term alcohol use a lot now.
Yeah, and so, I'm glad that you brought that up, and, with adults.
Yes.
So, we looked at ER visits recently, and, I did talk to Lexi, from Spiffy about this, in presenting to our select board around alcohol policies. So we can, at least safeguard some stuff there, but also, just present out to select board to do, for example, decreasing signage. Can we look at doing a nip ban, which we've talked about over the last couple of years around that, people throwing stuff out the window, but the alcoholism, the treatment part of it specifically, do we have recovery coaches that you guys are working with and stuff? So
That our model shifted now. It's not just recovery coaches. It's
Okay.
housing, it's financial support, it's mental health.
So
model's looking really good now.
Yeah, it's all everything cumulative, and I think that's a great thing. If we start at least this wellness resource thing, maybe people as it keeps progressing, maybe people will look at it and try to get help. But we do have people coming to our table all the time. We always want 2 people at our table because of this. We always have 2 people because there's always one, a couple people that come over that need help with their family, themselves, or their friends. And so it's pretty crazy that way. And, I have a substance abuse clinician background, so I'm able to help people and stuff. It's not my professional role here, but at least I know what I'm talking about and how to help people. But Kristen Krieger is the one who mentioned the uptick in ER visits in our area from Belchertown adult alcohol use. So maybe we can put our heads together around that and see what
I've talked to Derek too about this and seeing what other avenues we can go, or what avenues do we have.
Yeah,
So, yeah, it's definitely in the past 2 2-3 months.
Okay, maybe we can set up a special meeting to really just focus on that issue and to see what we can do in the community around it. Any other DART updates at all? All right.
No, I think Neil covered it pretty well. The only thing is, I don't know, today in Ware is a resource event happening through the Center of Hope Recovery Center. It's at Grenville Park. I didn't know if you were going to be there, Chris.
Yeah, we mentioned it earlier. Yep.
We're
Yep.
Okay.
Yep. We're gonna be there.
Yep.
Yeah, but we'll
We'll
be
see
there.
you there. Yeah,
We'll see you there. We did go to the Munson. Boat did go to the Munson program, and we ended up leaving. It was like raining out. I know Kathy, you stayed. How did it end up turning out?
It was fine. It was low in volume, but actually we handed out 3 cases of Narcan.
Oh my God! Wow.
Yeah, between the police department and us. Yeah, we were right next to each other.
That's awesome.
The weather did clear, so that was good.
Yeah, great.
Yeah.
All right. That's good to hear. That's really good to hear. And it's great to be able to support Munson now too, especially after they lost their grant. So we'll do what we can about that. Any like recovery harm reduction? We just talked about some stuff. Anybody have any more to say about that? All right. Any other partner updates?
I do. Sorry, apologies. I'm driving actually to one of my updates right now, so apologies for not being able to see everyone. So one thing that is coming up with Hampshire Hope starting today is a partnership with Tapestry. We're doing point-in-time harm reduction surveys. These are administered through brief interviews. Participants get $25 gift cards as compensation. Really with the hope of connecting with community members with lived or living experience to inform harm reduction services in Hampshire County, and also continue to help to inform ways for opioid settlement fund dollars to be utilized. So I will share when I'm on a computer the flyers with everybody, but we are at a variety of different partner sites over the next couple of weeks across the county. Would love to be in Eastern Hampshire County if there's someone who would be willing to host us, since these are happening in person. But I will share the information with folks so that you are welcome to all share with any community members you think might be interested in participating.
Yeah. Okay, great. Thank you, Lauren. I look forward to getting it.
Hey, Lauren, it's Neil. Didn't I see something recently too that I think it was Tapestry expanded their mobile Suboxone
Yes.
to either Ware or Palmer? I don't remember.
Palmer. They expanded because they were in Ware and then they expand. They were in Ware and expanded to Palmer, I think, right?
I saw something about it.
I don't think Tapestry is in Ware. It's not Tapestry.
No, yeah, I'm thinking the methadone, mobile methadone.
Yeah.
It's BHN Mobile Methadone is now in Ware
That's what it
and in
was.
Palmer every day.
Yeah, that's what it was.
10:30 to 12:30 every day.
Yeah, I know Tapestry does come to Belchertown to meet with some clients here. They don't have a specific location that they go, but they connect with individuals. I do know that they're doing that, but that is something that we would like to reestablish in Belchertown. We used to have the mobile Tapestry Mobile come like once a week to the Nest when the Nest was around. The Nest hasn't been around for a while. We don't have a location for that, but that's something that we are looking back into doing for our community. All right, any other partner updates?
Chris, if I could just go back to the public health. Oh, sorry, Rebecca, why don't you go? Go first.
I can give updates real quick. We have an event coming up in Grenville Park called Good Neighbor Day on September 27th. We're going to do a kickball game and ice cream social from 2 o'clock to 4 o'clock. And there's going to be a free ice cream truck, thanks to Fidelity, that has like a volunteer ice cream truck. And then we're going to do a movie in the park in the evening. So we are open to people coming to table if anybody wants to come table. We would love that. Not for the movie probably, but for the kickball game ice cream social. So that's 2 to 4 in Grenville Park. We were also at the Munson event, and actually, my colleague Sawyer said that they had really great conversations with community members, and they seemed really happy that we were there and for the resources. So that was a lovely event. We are also doing a social norms campaign with our youth with the latest data. So that's exciting that we're kind of doing that in tandem. And what was the other thing? Oh, we're going to be, after the September event, we're going to be looking to do a tips training. And the last time we tried to do a tips training, nobody from Ware took advantage of it. So we're going to try again. But Chris, if you have anyone from Belchertown that needs to get trained, then I can send you the information. They're welcome to join.
All right, great, thank you. Yeah, so we won't be able to come on the 27th because we already committed to the Sober in the Park event. But it sounds like an awesome event. That's awesome. That's great. Can't wait to hear about it. Any other partner updates?
Just a couple of things, Chris, back to the segment of the agenda about public health. Most of you know I'm on the Belchertown Board of Health now. Just to say that with the vacancy with the public health nurse, the Quabbin Health District, which is the employer of the nurse, is really looking at also boosting up the amount of community outreach and community work that they do. So Andrea and I and one of the members of the Pelham Board of Health have been looking at redesigning the job description. So just to say that when they have a new person in that position, you know, they should be coming to boat meetings. They should be involved with, you know, community stuff, including the program at the library that will kick off next month. And we're hoping that maybe once the job description is approved in October by the district of the 3 towns, then the hiring process and recruiting and all that will start. Also, just want to know that the meeting ended up being canceled, but again, BOAT and the drug-free grant and work with the Belchertown Board of Health continues to be a model around nicotine-free generation. South Hadley's looking at it, and board members as well as others are recommending that that anybody else looking at it, adopting that reg, follows the example of Belchertown, which is having the youth involved and having data and having all of that. So that's a really good thing. Just to say that Belchertown, again, is helping out other communities, particularly those that weren't willing to be first out of the gate, but now that other communities have adopted it, they feel readier to do that. So lastly, and I don't know how it might be relevant to BOAT, we could think more about it, but just remember that Bay State Wing Hospital's every 3-year community health needs assessment is in process. The report should be coming out by the end of this month, early October, to be available. And obviously, substance use and mental health are still huge issues in the entire service area of Bay State Wing. We did some focus groups with folks at the recovery center. I was involved with the needs assessment. But ultimately, there may be a short presentation about parts of the health assessment, and maybe for a future BOAT meeting that could be incorporated. I think we're going to do something similar at a future Board of Health meeting. And remember that what's in their community health needs assessment is what Bay State Wing has to devote dollars to under community benefits. So when there's an issue identified in their service area, that's supposed to match up with the grants and the funding that they provide in the community. So it has some direct relevance to resources as well as priorities, as well as what the hospital says it's going to participate in terms of partnerships.
That's great. And I wanted to talk also that with Ware and I know Northampton, we're doing that. Emma has put out the assessment too, as well, the community assessment, and she had 132 responses. And I know, like Aline and I at our open houses, we pushed it and pushed it in our farmers market. So hopefully you got more Belchertown people on, within that survey, because before I think we were kind of like lacking a little bit, but I think there was several people who took the QR code. So hopefully we have some representation from Belchertown. That's good. So.
Excellent. It's always any of our communities, and I know folks on this call represent a whole host of different communities across the region, that, it is really hard sometimes to get that hyper local data. So the more we can hear from actual community members in all of the towns, around the area, the better. All of that is to the good. And as you were saying that too, Chris, and I don't know if Rebecca wants to comment on it, but a meeting I was at recently where the town manager of Ware was also in attendance, he did note that Ware's select board just also approved the appropriation of some opioid settlement dollars, so that some of the work in Ware could continue. Some of it is federally funded, and it's not clear, what that picture might look like down the road. But at least Ware is now also using opioid monies to keep their eye on supporting existing efforts.
That's awesome. Great. All right. Well,
Chris, Chris, I can't get my camera on. I don't know.
That's okay.
But, what's happening. But first of all, Gail, it's always so nice to have you here. It's sort of like you have such the big picture of all this public health stuff. Good for all of us to hear. A couple of things that Spiffy is up to. We're recruiting for our youth steering committee, not to poach any youth that are involved with Helping Hands, but if there's a young person that's already involved with some work in coalitions, we are hoping to get real cross-section of young people across the county to be involved. And I'll forward the flyer. I can't figure out how to put it in the chat at this point.
Send it over to Aline.
Yep. Okay. I already have an email started, so I'll send that out soon.
You can
Also,
CC me on it.
yeah, I have you both on it, so you'll get it.
Thanks.
Also, Spiffy has a school health task force meeting coming up on the 25th at 3:30. We're going to focus on a presentation regarding welcoming schools. This is being implemented in Amherst. It's a anti-bullying prevention program for LGBTQ youth. Amherst is really implemented with a lot of trainings, and it's kind of a pricey program, but just an interesting discussion. We thought about like how does one implement some things in schools. So we've been having a whole series on presentations for schools to think about supporting student mental health. And so this is our latest one. Obviously, you'll see this Spiffy email coming out, but just wanted to remind people of that. And I'm glad to hear, Chris, that you're talking with Lexi about the alcohol roadshow. I know that she has presented with Sawyer and Ware, and I think they've had really just good discussions, and really to open that up to anyone who wants support. We're happy to support having those conversations at the municipal level around alcohol policies. And it's just, policy is a lot. So, Lexi was support of the regional policy and norms work group, did some great work in just putting all the information together and having resources. So we're happy to support that if there's other communities that you're talking with. So that is all. Thanks.
Thank you, Lisa. Well, I guess that brings us to the end. Any other comments, questions? Yes, Liz.
I'm going to probably send this as an email so I can have it written down. I was sent by my coalition to gather on the steps you guys took as a town to ban kratom. And I'm going to add also regarding becoming the nicotine-free generation. Is that okay if I send you an email for that?
Yeah.
Okay. Because I brought it up at our steering committee meeting, and they were like, go find this out. We wanted to see if we could present it in West Spring.
Sure.
Too. You guys have been really successful.
Yep. So we have, I have all the steps for it and stuff like that, because we did an award around it. So, yeah. All right. Awesome, Liz. All right. Thank you so much, everybody. And please come to the parade if you can, in front of the library, 8:45. Have a great day.
I know you always forget, so I remember too.